Hi friends, today I will teach you reticulohistiocytosis. So what is the reticulohistiocytosis? The name itself suggests histiocytosis means obviously there is a presence of tissue macrophages, right? It is called histiocytes. So there will be presence of macrophage, abundant macrophage. That's why the name of this tumor is given as a reticulohistiocytosis. It can be of the two types. It can be giant cell reticulohistiocytosis or it can be multicentric reticulohistiocytosis. What will be the clinical presentation? You have to remember that there will be presence of cutaneous papules or nodules. So there will be presence of papules or nodules over the skin, right? The common sites of involvement is face. It can involve ear, it can involve arm, scalp, and sometimes oral or nasal mucosa. The patient will have the manifestation of destructive arthritis as well. That is typical history regarding the heretical histiocytosis. So destructive arthritis can be present, and the usual most of the patients are adult one. And if you take the history, such patient is usually having the high cholesterol level. So you have to check for cholesterol level as well. So that is the regarding the basic clinical idea of reticulohistiocytosis. Now we will see the microscopic findings. So name itself suggests that there will be presence of histiocytes, right? So you can see that there is a presence of many macrophages. These foamy cells are macrophages, right? Macrophages and fibrous septa is seen. These all are the histiocytes. In the histopathology, histiocytes look like that of this one, having the centrally placed nucleus, central or eccentric placed nucleus, and foamy cytoplasm. But here, what happened? If you zoom the figure, then you can see that many macrophages is having the granular eosinophilic cytoplasm, right? You can able to see the granular eosinophilic cytoplasm in many macrophages. So it will overall giving the appearance like that of ground glass appearance, like the cytoplasm is ground glass in most of the macrophages. So that is the typical feature. We can say that cytoplasm looks like and clear. So that is regarding the reticulohistiocytosis. There is obviously presence of giant cell in this entity. The giant cells are present. Unfortunately, I have not the image that showing the giant cell, but giant cells were present, right? That's why we have given the diagnosis of reticulohistiocytosis. This is the another field. You can clearly see that granular eosinophilic cytoplasm in the macrophages, right? All these are macrophage. This is having the clear cytoplasm. Just see that cell. Here also the cytoplasm is very clear, and in some it is the oncocytic eosinophilic granular, right? So this is regarding the reticulohistiocytosis. Now, what can be the differential diagnosis of this reticulohistiocytosis when such abundant histiocytes can be seen? So you have to remember the two important differential diagnoses, that is a juvenile xanthogranuloma and the Rosai-Dorfman disease. Now, what happened in juvenile xanthogranuloma? In that condition, there will be presence of Teuton giant cell. Remember that name. There will be presence of Teuton giant cell, right? The cytoplasm is very foamy in the Teuton giant cell, and there will be presence of eosinophils in that of xanthogranuloma juvenile. The other variety is Rosai-Dorfman. The second differential diagnosis is Rosai-Dorfman disease. What happened in that RD disease? Usually in Rosai-Dorfman disease, there will be presence of lymphoplasmacytic infiltrate. There will be presence of lymphoplasmacytic infiltrate. Lymphocytes and plasma cells are seen, and that will be separated by fibrous septa. That is seen in Rosai-Dorfman disease, and there is usually involvement of multiple lymph nodes as well. Sometimes adenopathy can be seen, and the histiocytes are very pleomorphic in Rosai-Dorfman disease. So these two diseases can easily differentiated from reticulohistiocytosis. So that was regarding the diagnosis of reticulohistiocytosis. The patients are usually adult one. Hope my video will be beneficial to you in making the diagnosis of reticulohistiocytosis. If you like my video, subscribe my channel and press the bell icon. Don't forget to press the bell icon so that you can get notified whenever I am posting the new videos. Thank you very much.